Hi, everybody. Welcome to the COVID313 Community Coalition for Families and Students Teletown Hall. My name is Christine Bell, and I'm honored to serve as the Executive Director of Urban Neighborhood Initiatives. I'm a member of 482 Forward and your co-host for today's Town Hall. We are excited to have you here with us today, and we're going to get started in just a few minutes. We want to give folks time to join us on Zoom or by phone, and we also are trying to get us up and running on Facebook Live. And so we're going to need just a few minutes for that. In the meantime, Cindy, could you please share the number for Spanish translation for the folks that need it?
Claro, si necesitas traducción en español, por favor, habla al 313-626-7440. Otra vez, el número es 313-626-7440.
Thank you, Cindy. Katie, could you please share the instructions for ASL?
Thank you. And hello, my name is Jametta Lilly, and I'm blessed to serve as the CEO of the Detroit Parent Network. But before we start, we first want to let you know, all of you there, how blessed we feel to have you join us today and to be part of the launch of our COVID313 Community Coalition for Parents and for Families. So thank you so much for joining us. But before we get into our program, as you probably know, we're all using some new technology here. So whether you're Zooming in, you're listening to us on Facebook, we've got a lot of moving pieces. We have some phenomenal experts to be with us today. So we may have a few difficulties, technical. Hang in there with us if you would. I'd like to tell you a little bit about the coalition. We are so pleased that we have over 25 community-based organizations, foundations, faith-based organizations, as well as the city of Detroit. And we are comprised of parents, family members, youth, folks just like you who are trying to work through these truly uncharted waters that coronavirus has stirred up. But we know no matter who you are, whether you're a young person at home trying to figure out what's going to happen with your high school graduation, whether you're a mom who's pregnant and want to know, well, what do? I have some anxiety. Whether you're a senior, we know that families need facts, and you need support, and you need resources. And that's what we've all come together to do. And while we all know that we need to keep this thing called social distance in place, we still have to stay connected. So we are coming together precisely for that point, to be connected. And so we're going to be coming together in a way that is always informing us. We're learning, we're sharing, we're listening to each other. And ultimately, what we want you to know, when you join with the coalition, every week, we'll be doing these same kinds of opportunities. But we want you to know that this is what is important in this really critical time. And that is Detroit can stand strong. That with our families, our children, and our community, we really believe that we will meet this challenge and come through it. And perhaps even we'll appreciate each other a little bit more as a result.
Yes, staying connected is our key purpose here. The town hall format will begin with comments from our caring experts, and you'll hear from them over the next hour or so. Soon we'll hear from the following experts: Kirk Mays, the CEO of Forgotten Harvest; Crystal Hepburn, team lead from the Detroit Health Department. She is the Children's and Special Healthcare Services Coordinator. Jay Clement, Director of Community Health Programs and Strategies for Henry Ford Health Systems. State Superintendent, Dr. Michael Rice, AFT President, David Hecker, Dr. Nikolai Vitti, Superintendent of Detroit Public Schools Community District, Dan Quisenberry, Director of the Michigan Association of Charter Schools, Jeremiah White, Implementation Success Manager for Hope Starts Here, Monica Rodriguez, City of Detroit, Director of Children and Youth, Louis Pinsker, Director of Wayne Metro, and Dr. Driver Hudson, CEO of United Way of Southeastern Michigan. Stay on so you can hear what you need to know from our experts, but this won't just be a one-way sharing. We want to hear from you. So please use the chat or the Q&A section of your Zoom or Facebook as soon as we're able to get on Facebook. We will have question and answers at the end of the program. The questions that we're not able to answer today will be posted on the COVID313.org website, which you'll hear about shortly by Monday. Cindy, could you please share one more time for our folks that need Spanish translation, the number they should call?
Claro, si necesita traducción en español, por favor, hable al 313-626-7440. Desafortunadamente, ahorita no estamos haciendo traducción. En cuanto se resuelve el problema del Facebook Live, gracias.
Great, thanks, Cindy. Katie, could you please share the instructions for the ASL one more time? Great, thanks, Katie. So let's get started. To kick us off today, please welcome Arlissa Hurd.
Christine, just an announcement for folks before we start. Sorry, this is Molly.
Thanks, Molly.
So just so folks know, we are having there's something happening with the connection between Zoom and Facebook, and it's blocking the number of attendees that are coming into our room. If you can tell friends and family who are trying to get on that we will post this right away, we will post it immediately afterward, and the questions and answers will be answered as well. I'm getting a lot of texts. We know that it's a problem. The room is full in Zoom, which is a good problem to have, but it's something going on. So I apologize. Go ahead. Sorry, Arlissa.
Okay.
Thanks, Arlissa. Go ahead.
Thank you, Christine. Hi, everyone.
No problem, man.
My name is Arlissa Hurd, and I am a parent of an 8th grade student at the James and Grace Lee Boggs School in Detroit. I am also a first-time grandmother of a 5-month-old, and I am also a parent to an adult child, or an adult son, I should say, living with sickle cell disease. I am an organizing member of our organization called 482 Forward, and my family and I reside in the Focus Hope area, which is also known as Hope Village. You know, the funny thing about crisis is that it shows us, all of us, who we are and who we are as a whole and who we are as individuals, as well as a community. And in times like these, we need trusted resources and trusted information to help our students and our families get what they need. So right now, our community has come together in a big, big way, because we want to be the help that we need. Quite frankly, these are scary times, very scary times for most of us, all of us actually. And there are lots of questions, lots of concerns, and all kinds of information coming from different directions. And keeping up with growing list of available resources, trying to find the latest school updates, or just trying to figure out where to get accurate health information has proven to be quite a challenge during this time. So today, we are so excited to have live participants on Detroit Public Television, Facebook Live, on the phone, and here with us on Zoom for this webinar. Now I'll give it over to Cindy. Cindy?
Thank you, Arlisa, and thank you everyone for joining us today. It's very important everyone get as informed as possible. My name is Cindy Gamboa, and like Arlisa, I am also a parent to 3 amazing children, one of which is a DPS-CD student. I live in Southwest Detroit, and I have the honor to be the organizing director at Detroit Hispanic Development Corporation. Today, I'm here to tell you guys who we are. We wanted to make sure that students and families have regular information about what is happening during this crisis. There was over 20 organizations that came together in response to this crisis and formed the COVID313 Community Coalition for Families and Students. These organizations include the Congress of Communities, Mothering Justice, Detroit Parent Network, Detroit Hispanic Development Corporation, My Student's Dream, 482 Forward, Urban Neighborhoods Initiatives, Whitmer Alliance, Focus Hope, Hope Starts Here, Total Life Christian Ministries, The Village PCL, Human Foundation, Brilliant Detroit, Detroit Public Television, Detroit Community Education Commission, United Way for Southeastern Michigan, Michigan Association of Charter School Authorizers, and Detroit Public Schools Community District. On the call today, we have representatives from each one of these organizations. You should see them now. Partners, will you please turn on your video so that the audience can see who you are? Great. So on this call, again, we just want to reiterate 2 things. This coalition is doing a lot of work, and we are committed to doing 2 things for students and families. One is that we're working hard to coordinate resources for all students and families. We're doing that by putting it all in one site, covid313.org. The city will talk more about this during their presentation. The second thing that we are committed to is making sure that we have weekly live town halls every Thursday from 12 to 2 to make sure that everyone is getting the most up-to-date information. So please continue to join us and tell a friend and neighbor that might also need this information. Now, I'm going to go ahead and pass it on to Nkenge Browner.
Hello, everyone. I'm Nkenge Browner. I am a mother, a native Detroiter, and the organizing director at Mothering Justice. We're excited to be here today to be able to introduce you to the following experts who will give you updates on what's happening in the COVID-313 closure. The following experts will give updates today. Kirk Mays, the CEO of Forgotten Harvest. Denise Fair, the Chief Medical Officer of Detroit Health Department. Jay Clement, Director of Community Health Programs and Strategies, Henry Ford Health System. State Superintendent Michael Rice, AFT President David Hector, Dr. Nikolai Vitti, Superintendent of Detroit Public Schools Community District, Dan Queensberry, Director of the Michigan Association of Charter Schools, Denise Smith, Director of Hope Starts Here, Monica Rodriguez, City of Detroit, Director of Children and Youth, Deon Williams, Director of Faith-Based Affairs, Louis Pitzer, Director of Wayne Metro, Dr. Darian Driver Hudson, CEO of United Way of Southeastern Michigan. We have speakers between now and 1:30, and then we have a 30-minute question and answer. You can post questions in the Q&A tab on Zoom. If you are on Facebook Live, we have chat moderators that will answer questions and post questions on the Zoom for our panelists to answer. A few rules for the chat and on Facebook. Please keep the discussion around each and every topic respectful and civil. No foul language, no trolling. Please keep to the topic of discussion. There will be designated time for question and answers where other related topics and questions can be discussed. No posts with graphic or disturbing photos, videos, or other media. If you comment or post in the discussion, we ask that you try to add something unique or original to the conversation in order to be respectful of all participants and to help those monitoring the discussion. Absolutely no promotions or sales pitches. If you have something to donate and it is directly related to the discussion, you can share it in the chat. We, as group admins, reserve the right to remove or block someone from the live feed for violating these policies or at our discretion for any reason at any time. For those participating via Facebook Live, please keep Facebook's community standards and terms and policies in mind. Not all of our experts are able to stay on the call the entire time. We are committed as a group to posting the answer to questions that aren't answered by Monday on our partner Facebooks. We'll also post a live recording of this on COVID313.org. If you would like to sign up for regular updates and get reminders from our group, please sign up on COVID313.org. For those of you that have just joined us, I'm going to have Cindy and Katie tell us again how to connect if you're a Spanish speaker or need American Sign Language interpretation. Cindy?
En español, por favor, hable al 313-626-7440. Otra vez, el número es 313-626-7440.
Katie? All right, I'm going to turn it over to our moderators, Christine Bell and Jametta Lilly.
Thank you. I just want to let folks know that we're still having some issues, technical issues with Facebook and Twitter. We're trying to work them out the best that we can. And if we are unable to, we will post this right after a recording of this right after we're done today. Technology is not our first expertise, so we're doing the best that we can. Sorry for some of the glitches. We're so grateful for our expert panelists that could join us today to share the 3 to 5 pieces of information that you feel are most important for our families and students to know during this very unsettling time. Please remember to speak slowly for our translators. If you go over your 5 minutes, we've got Terry Whitfield that will gently remind you to wrap it up. Question and answers will happen at 1:30, but if there are important questions in the chat, us moderators may chime in and ask them for you to answer them after you speak. So we're gonna kick it off with Kirk Mays, the CEO of Forgotten Harvest. Welcome, Kirk.
Thanks for having me. How you doing today, Christine?
Good, how are you?
Everybody. So I'm just going to jump right into the 5 things that we want everybody to know. Is that right? Okay,
that's right.
So for us right now, for Forgotten Harvest, we're working on making sure that we can continue to serve the community through this tough time. So we are right now transitioning to a kind of what we would call a super site to do our community repack of semi-perishable and non-perishable items. So we're actually currently moving the bulk of our operation to TCF Center. That's not publicly announced just yet, but you'll start hearing about that shortly. We'll be using Oak Park between 8 and 9 Mile and Greenfield, if you're not familiar with our headquarters, to do repack of cold items or things that need to be actually protected with refrigeration. We will deploy to 15 sites around Wayne, Oakland, Macomb County from those locations with our refrigerated trucks. The idea is that we're going to be doing dry repack in a format that allows the right kind of social distancing for our work streams. We're currently checking in with certain health professionals from U of M and from OSHA to look over our plans to make sure that we're thinking the right way about how we're spacing and repack. There are about 14 conventional community partners that we're probably going to continue to serve. What they're going to do is also go into a kind of drive-through drop-off format that allows everybody to have the least amount of touch points and the least amount of exposure. And then we'll also do that at each of our 15 sites. The idea here is from our dry repack, we'll send a truck, and from our cold repack at Oak Park, we'll send a truck. And those 15 sites will be served once per day, and they will get about enough food for 700 families. We intend to put together, we're organizing boxes right now of about 30 pounds a piece of a mixture of things that we typically get from our community partners. And then in our cold giveaway, we're going to be giving away those box lunches for the children. So each site that people go to on a daily basis, right now we're planning on 700 people at those super sites or at the new format site, and everything will be repacked pretty much either Oak Park or at TCF Center. That's the general idea. We will be in Gompers. We will be in other rec centers across the city, and we'll give out the information about where we'll be as we complete and solidify these plans. But between now and Monday, we'll let everybody know where they can go to get food. Other than that, if anybody has any questions, we are working feverishly to get protective gear for our volunteers and everybody that we're working with. We're trying to get enough for our agency partners. We're making some progress, and I'll have some updates as soon as I have stuff in hand, maybe as early as tomorrow. And if I got time, I just want everybody to just really pay attention to this thing and stay safe. Take it serious. If you're on lockdown and you're at home and you don't know what to do, I suggest that everybody try to pick up a good book. I suggest that you take some time in the day to try to inform yourself of what's going on. But yes, unplug. When you inform yourself, make sure you take a priority to the local information, the state information, and search out credible global information so you can know what's coming for us. Read a book, learn how to yoga, go exercise by yourself, do some of the stuff that we probably all needed to do when we didn't have enough time to do it. But please, please, please take this seriously and do what you got to do your part.
Well, there's a quick question that is being asked, if you can hear me, from one of the attendees, is who qualifies to receive this food? If you can just really briefly touch on this, because time is flying.
We don't have any qualification requirements at this time. We just hope that everybody is responsible about going out to get the resources. They are limited. We're looking at a reduced supply from our grocery partners, as all of you can imagine why. We hope that that's going to actually go back to a normalized level over time. Whereas at this point, we're 50+% down in our typical flow from grocery partners. We're doing everything we can to get food from every place we can get it, but we're asking people to do the most they can to be responsible right now with whatever you have. So if you can stretch things, if you can take the time to really make sure you let things actually last as long as possible, I and everybody out here is asking everybody to take that time to do that, reduce the amount of times that you leave the house, and try to do your best to let everything you have stretch.
Thanks, Kirk. Jametta?
Yes, Kirk, thank you so much for not only talking to us about the importance of food, but it's not just the food that goes into our body, it's what we do with our spirit as well, and how we relieve stress through a time like this. So appreciate you making that context for us. And that's actually a perfect segue, because when we think about health, health is a combination of things that are physical health, but also our mental health. And through this virus, through this kind of pandemic, we know how important our public health officers are. So we're very pleased to present to you one of our own right here in the city of Detroit, and that's Crystal Hepburn, who is part of the lead in Children's Special Healthcare Services at the Detroit Department of Health. Please welcome Crystal.
Hi, good afternoon, Jametta and everybody. Thank you so much for allowing us to go ahead and be on the conference call today. I would like to go ahead and reassure that keeping Detroit residents healthy and safe is the #1 priority of the Detroit Health Department. In an effort to protect residents, the Detroit Health Department is continuing to work around the clock with the Michigan Department of Health and Human Services, as well as the Center for Disease Control and Prevention actively. So far at the moment, we know that we have 717 confirmed cases in Detroit. We do expect that number to go up because we are quite populated in this particular area, and there's been a number of tests completed that we are still awaiting results. In the Detroit area, we also have 15 confirmed deaths. Within Michigan, we have 2,295 confirmed cases and unfortunately 43 confirmed deaths within Michigan. From what we're learning, those that are hospitalized, 24% of the positive cases are ending up in the hospital systems. They have quite complex complications that go ahead and require them to be hospitalized. They're quite severe. 76% of positive cases can be managed at home. They have quite mild cases. The majority of people within Detroit that have tested positive so far, approximately 40% are between the ages of 50 to 69. The Detroit Health Department has a 24/7 hotline set up for the community to go ahead and contact them if they have any questions or need some screenings. That phone number is 313-876-4000. We ask that you press number 1. We also have an email address that is monitored around the clock as well. That is dhdoutbreak@detroitmi.gov. We do have some wonderful resources, as Kirk had mentioned. Make sure that you are looking at trusted resources. So we do have the Detroit Health Department's website. It is detroitmi.gov/coronavirus. I'm sure everybody's heard about the additional testing sites that we are planning on setting up starting tomorrow. There will be a regional drive-up testing site opening in Detroit as a result of the cross-county city and health system partnerships. They do expect that testing will be done from Monday to Saturday, 7 a.m. to 6 p.m. at the State Fairgrounds in Detroit, starting tomorrow, Friday, March 27th. Test results are expected within 5 days. Individuals that would like to be tested must have a screening from their doctor, a written doctor's order, or a prescription, as well as making an appointment. To make an appointment, they need to call 313-230-0505 to schedule the appointment. When they do come in for the screening, they will provide their doctor's order or prescription along with their identification. The screening time period is expected from 7 a.m. until 6 p.m. Oftentimes we get asked, how does an individual get determined whether or not they're screened? The testing is dependent on the current status of COVID-19 in local communities and their immediate proximity to anybody who has tested positive, the additional symptoms that they have been displaying, with the fever of 100.4 or higher, dry cough, difficulty breathing, or shortness of breath, as well as if they have been exposed to an area in which there has been individuals that have tested positive. We do want to make sure that everybody is monitoring their signs and symptoms, making sure that if they do have a temperature, they're taking control of that with medications, increasing fluids. We want to make sure that everybody is aware and taking care of themselves, both physically as well as mentally. And we suggest reaching out to Detroit Wayne Integrated Health Network should they need to go ahead and receive any type of services. They do have a 24-hour hotline at 1-800-241-4949.
Thank you so much, Crystal. And
Sorry,
I
I
want to
went
remind
over.
panelists to please speak slowly for our translators. We've got folks that are translating into Spanish in real time. And so if you can just maybe go a few seconds slower than you usually would. Jametta?
Sure. Thank you so much, Christine. And Crystal, thank you for that information. We know that information is critical, and many of you were probably taking notes. So what you will be confident in is that as soon as this event is over, we will make sure that we publish this critical information because we heard telephone numbers, we heard opportunity for testing tomorrow based upon your physician, your proximity to someone who has potentially contacted the disease. So we'll make sure that you have more details as we go forward. Again, health and wellness is so critical throughout this time period, and having trusted sources for information. And as we talk about trusted sources, please go ahead.
I'm sorry, Jametta. There are two questions for Crystal. Crystal, could you go through the stats one more time? How many folks have the virus in Michigan, and then how many in Detroit?
Of course.
And there's one other question.
Okay, no problem. I'll take the first question. Within Michigan so far, as of 11 a.m. this morning, we have had 2,295 cases confirmed for the COVID-19. We do reportings with a number of times a day, so that is expected to go up later this afternoon. Within Detroit itself, as of 10 o'clock this morning, we have 717 cases, of which unfortunately we have had 15 succumb to this particular virus, just in Detroit, and 43 within Michigan. It is quite severe. We want to make sure that everybody is aware and taking the precautions suggested to make sure that they do not become positive.
Thank you. And then can you provide any information around whether testing positive or not, will the charges for testing be passed along to the patient's insurance?
Okay, thank you very much. At the moment, I believe the understanding is whether it be somebody with insurance, anybody who is undocumented, anybody with signs and symptoms that are professional provider is suggesting that they get the test. Those are provided complimentary. I understand that should somebody need to be hospitalized if they have severe complications related to this virus, that there will not be any charges put forth if they do not have the insurance to go ahead and pay for it. There will be bills sent, but if they cannot afford to pay for it, they will still get the treatment. They will not be denied.
Great. Thank you. Back to you, Jametta.
Yes, and thank you again, Crystal. So what I would like to do is to repeat, there were two important telephone numbers that you gave. One was the City of Detroit Health Department hotline, if you could repeat that. In addition, you talked about the opportunity for testing and what would be the telephone number that if they met the criteria, they should call. Crystal, could you kindly reshare those two telephone numbers?
Of course. Our Detroit hotline, which is operational 24 hours a day, 7 days a week, is 313-8 4000, then we need the individual to press number 1. Okay? If for some reason, if somebody's been screened by a primary care physician or a doctor, if they have a written order or a prescription from their provider, they can then call to set up an appointment at 313-230-0505. This will allow them to make an appointment during the time slots available Monday through Saturday for the testing that will be taking place at the State Fairgrounds in Detroit, on East State Fair near the 8 Mile. You will be entering in from the East State Fair entrance and exiting from Woodward. Or actually, I think that's West State Fair on that particular portion.
Okay, Crystal, thank you so very much. Again, we're going to also have an opportunity next week to take a deeper dive into health. And we're pleased to say that Henry Ford Health System, which is one of the significant health systems that we're blessed to have in our community, will be providing more information next week. But now what we'd like to do is make a transition to the other voice that's really important for us to hear from right now. Food, health, and now to talk about education. We're very pleased to have the superintendent for the state of Michigan, Michael Rice, to join us. Michael, if you would. Dr. Rice, if you're available.
Yes, can you hear me now?
Yes, we can.
Very good. I apologize for not being able to be there by video, but appreciate the opportunity to speak with you today at this very difficult moment in our history. 16 days ago, on March 10th, we had no COVID-19 cases. Just 2 days later, with 12 COVID-19 cases, our governor announced school closures. I appreciate very much the governor's leadership during this crisis. I want to touch on several points very quickly. We've already heard about food. Know that the day that the governor announced school closures, we applied for a federal waiver with USDA to allow so-called non-congregate meals, meals outside of schools and outside of school cafeterias. This waiver permitted 1,600.
Uh-oh.
Michael, it looks like we've lost your connection with you. Dr. Rice?
Hello?
Okay,
Can you hear me now?
You're back.
Okay, sorry, I apologize for that. We applied for a waiver. The waiver permitted the non-congregate meals, the meals in communities, 1,600 stationary sites, 600 mobile feeding sites across the state. And we anticipate additional federal funding to help us in the area of food distribution, food provision in the coming weeks. There is a bill that passed the U.S. Senate last night. We anticipate it will pass the U.S. House, will be signed by the president, and we are hopeful that that will add additional food resources within our state. Child care. We worked with the governor and other governmental agencies on the creation of a child care network. Some schools are now used as child care sites for essential workers. State M-STEP testing. We applied to the U.S. Department of Education for a waiver last week for the federal requirement to do annual state tests. We have received that waiver. We still need a state waiver from the state legislature. It's hard to imagine the logic of doing state testing in the midst of a public health crisis, but we do need state legislative action in this regard. We've issued guidance on special education services, federal funding, career and technical education, student teachers, and many other areas. I would just like to note two other important areas. Graduation requirements. Every senior who is on track to graduate before this crisis should graduate. We are committed to making that happen. We are working with legal counsel to confirm that there is sufficient flexibility within state law for local school districts to help seniors graduate without the need for more state legislative change. If there is the requirement for state legislative action, we are going to work with the state legislature to make that happen. And then finally, distance learning. I have enormous respect for our teachers, support staff, and administrators anytime, during any day, but particularly during this time in the midst of this extraordinary crisis. That said, as everyone knows, there's a huge gap between the haves and the have-nots in this state and in many other states regarding home technology. We just did a quick survey of school districts across the state. That survey indicated that some districts have only 25% of their children with a computer and with connectivity at home. Every district can't migrate currently to an online environment for their children. In the short term, we all need to do the best we can. Some districts will have full virtual learning. Some will have packets of information. In the midterm, long term, we're working with the governor and our education partners to address the digital gap throughout the state and to permit all districts to set up a virtual learning environment. But that's going to take a considerable period of time. Recognize that if approximately a third of our young people do not have a computer or connectivity at home, you're talking about the homes of 500,000 children. And that doesn't include children who may have the computer and the connectivity, but may struggle with it because they're young, or because they have particular special needs, or because they're English language learners. They don't necessarily have the support at home to help them connect. So we're committed in the midterm, long term to addressing this digital gap across the state, but it's going to take a considerable period of time. We're working very, very hard with our partners on this, and we're going to want as many partners in community as we can get. And finally, the last thing is pay. All school days need to be compensated, and all school employees and contracted service providers should be paid as well. But we need legislative action. We need our state legislature to help make this happen. The legislature needs to address the hours, days, and attendance requirements under state law. Under current state law, there are 1,098 hours required. There are 180 days required, 75% attendance for each day. State legislature needs to amend those requirements, or to acknowledge that these days of public health emergency count as instructional days. One way or the other, they need to acknowledge that school districts will be fully paid so that their employees can be fully paid. Our school employees, our school contractors are our neighbors, they're our relatives, they're our co-parishioners, they're our friends, they're our family. And in the midst of a public health emergency, and conceivably in the midst of a recession and or worse, we need to support pay for these school employees. And the only thing else that I would say to everyone is to stay healthy and stay strong. It is a brutal period. We are going to get through this. Thank you.
We have a question for Dr. Rice and Dr. Vitti from Facebook. It is, I want to know if the schools close, will DPS accept virtual learning to pass the child?
Is that for me or for Dr. Vitti?
So this is, it's to either one of you. Is Dr. Vitti on?
Dr. Vitti isn't on yet, so we could say that when he gets on.
Okay. Dr. Rice, do you have any feedback as it relates to that? Or would you like to let Dr. Vitti answer that one?
There are a number of things that are going to be local discretion. I happen to think that it's going to be very difficult to grade children during this period of time. But local school districts are going to have to make local decisions on that issue. There is no requirement to do so. Again, local school districts are going to have to reflect on their capacity to continue to deliver instruction in some way, shape, or form, and make determinations of whether it makes sense to grade during this period of time or not. I think there is so much that needs to be done in terms of meeting basic needs, in terms of meeting food needs, in terms of meeting social and emotional needs, in terms of making sure that our children are grounded, providing whatever supplementary instruction that we are able. In many, many communities, that is going to be sufficient. And the notion of cobbling together grading during this period of time may simply be too much, particularly given the digital gap, particularly given the absence of computers and connectivity.
Dr. Rice?
Yes.
Thank you so much for your comments that also create some opportunities for those of us at home. You identified some opportunities for us around advocacy. And all of the coalition recognize the huge disparities that exist economically and how that impacts food, education for all of our families. And your comments really lift that point up. So we encourage all of you that are listening to be sure to touch back with us, because we certainly need to make sure that our state legislators and others understand the needs that our children, our parents, and our families have as we try to work through this in a way that keeps us whole and moving forward. Dr. Rice, thank you again for your comments.
Thank you very much.
We have one other question that I think only Dr. Rice can answer at the moment.
Okay.
So if you don't mind, Dr. Rice, staying with us for just 1 minute, we have a
Sure.
superintendent that is with us and would like to know if there is movement to ending the academic year as some other states have done.
Yeah, so, it's obviously a question for the governor. I think that a lot turns on what you mean by ending the academic year. If you mean ending learning for the next couple of months, I'm not in agreement with that. I think we need to continue to cobble together the absolute best we can do in each of our districts to continue to educate children. And of course, I know Dr. Vitti feels the same way. I do believe that all districts need to be compensated for these days. I respect the fact that school, as we have known it, is not going to continue during whatever extended period of public health emergency that we have. But I still think we have the requirement to say that we are going to continue to work to educate children, even at a distance, even given the challenges associated therewith. So it's one thing to say that we may at some point end the school year as we typically have thought about the school year, but it's another thing to say that we'll no longer be working each day to serve children and to educate them in some way, shape, or form to the best of our ability in this new world.
We have one more question for you, Dr. Rice, and thank you again for being with us. What can the community members do to support schools at this time?
Well, I would say if you have a connection to a young person or young people, and you are able to help cobble together and help oversee their instruction at a distance, please do so. Read to children, write with children, work with children on their mathematics, help them with any school assignments that they may have, either in a virtual environment or a more traditional paper and pencil environment. Anything you can do to wrap your arms around children, either literally or figuratively, actually more figuratively, I suppose, at this moment, would be enormously appreciated. Many of us are concerned not simply about the huge public health implications that exist now regarding this public health crisis, but we're also concerned about children losing out on instructional time. And so to the extent that you can help us cobble together opportunities for young people to stay focused on learning, that is enormously impactful. It is not going to be per se the learning that they might have done in school, but that doesn't mean that it can't exist. It doesn't mean that it can't be helpful and impactful to them. Thank you.
Thanks, Dr. Rice. There was a note that said that there's some folks on that believe that we need to expand the number of partners in this effort. We have a few other questions for you, and so we're going to make sure that we get these to Dr. Rice, and we will have them up by Monday on COVID313.org. Thank you for being with us. Jametta?
Thank you so much.
Thank you again, Dr. Rice, and certainly giving us that view from the state that impacts all of our local districts. But we know the other voice that is so important in this process of educating our children gets right down to the nuggets of our teachers. And so to bring us an expert voice of the concerns, the needs, and the ways that we can partner with teachers, we're pleased to be able to welcome David Heckert, who is the president of the American Federation of Teachers here in Michigan. David, please.
Thank you. Thank you so much for the opportunity to be on this teletown hall and for the great group of people you have providing great information. I'm going to try to be brief because a bunch of what I'm going to say really is in line with what Dr. Rice is saying. Obviously, we're working closely together and with many other partners. On the specifics, it's making sure teachers are figuring out everything they can do and already doing everything they can to educate children. In reality, it's probably going to be more enrichment because it's not going to take the place of a teacher standing up in front of the classroom interacting with the kids, but it's incredibly important to do. We are extremely cognizant of the digital divide. And as Dr. Rice said, it's going to take time to address that. And maybe that's something positive that comes out of this, that gets addressed. But in the meantime, teachers are putting together education packets for those not able to get online and are working to take their classes, their curriculum, and put them online for those who have access to that. But we have to make sure every child has access to an education in these coming months. Making sure that the food gets to kids and families. Some districts have had to take a step back and just sort of change how they do that, which is understandable. Everyone is doing it on the fly, but that great work continues, and support staff and teachers are heavily involved in that. As Dr. Rice said, the state needs to waive testing. We need to figure out graduation, which I'm sure we will. And we have to make sure that all school employees are getting paid. And all teachers are. Most support staff are. I think there's probably a few examples of support staff who are not called into work not getting paid, but everyone should get paid. And more than that, what we're fighting for. And some districts are doing this, that everyone gets paid. But if I call you in to prepare and get food to kids or whatever else I call you in for as an hourly worker, you get overtime. And some districts are doing that. And I think that's the exact right, fair thing to do that we're fighting for. A big thing on timing is this has to be done now. We all realize that this is going to go longer than we like. We all realize that in the future, be it a pandemic, hopefully not, but a pandemic, or something like last year when we had those extremely cold days when the governor closed schools for a few days, that we're going to be in a similar situation in the future. So we do need to think about long-term ways to address all this. But we have to now give parents and students and school employees certainty as to what's going to happen. That these days need to count so that schools get their money. And that really has to happen. The legislature really has to take that action immediately. They haven't yet. No one said it's not going to happen, but it's something that really, really has to happen now. One final thing I mentioned that everybody here knows as well, if not better than I, because you do incredible work every day. But we also have to try to use this crisis when we get past the health piece to accentuate the point that you all live every day, that the people getting most hurt by this crisis are the people who get hurt every single day and are undervalued and not fairly compensated and don't have the resources and are on the unfortunate end of the digital divide. This is not new. Who is really being hurt by this the most? And we really got to try to use this situation to try to structurally address those ongoing issues, of course, once we get past the health crisis. So I just want to conclude and thank everybody and ask everybody to do what you're doing and stay as safe as possible. Thank you.
David?
Yes.
Thank you so much. You've also identified something that another one of our educational leaders speaks to all the time. And that is that which we've not done before is always going to come back and bite us. And so there's a critical need to address these structural issues of the disparities that exist in our health systems. And so here to help us talk about that and to hear what is going on in the Detroit Public School Community District, we're very pleased to welcome Dr. Nikolai Vitti to make remarks. Dr. Vitti.
Hello, I assume you can hear me okay. I hope everyone is healthy and families are healthy. For students on the call, I just want to emphasize the need to socially distance and socially isolate. You, as younger folks, are less likely to be extremely sick, but you can carry the virus, and that virus can be carried off to someone whose immune system is not as strong. So I've been continuing to receive emails, phone calls from people to try to urge our youth to also socially isolate and distance. And I just wanted to use the opportunity quickly to say that. With that said, I just want to thank everyone on the phone for all that they're doing. We certainly don't feel alone, from Dr. Rice to David to others on the call. I want to specifically thank Dr. Rice for advocating for the elimination of testing. I'm glad he took that stance. We now don't have to worry about that. In addition, I do want to also commend, although not necessarily popular, Dr. Rice's decision to say that anything that happens from this point on should be enrichment, not required. And the reason why that's important is because we already have a significant digital divide, an socioeconomic divide in this country, specifically in Michigan and Detroit. And if we allowed for instruction to be required for grades, we would disadvantage a large number of students, not only in Detroit, but throughout Michigan. And I think that was an important point. I think learning should continue. We are doing that as DPSCD with academic packets. And we're going to expand that by mid-April, where we're going to have more learning take place or learning opportunities at the K-8 level. We'll put that online. More information will be sent about the details of that. Our focus will be reading and math. There'll be videos explaining the lesson, materials to complete. We'll work with our teachers union to have teachers review that material, give feedback. About 80% of our families have been reached out to from our teachers and administrators at schools. At the high school level, we'll start to ramp up more lessons in reading and math, continuing with PSAT and SAT with Khan Academy. iReady is available at the K level for reading and math. So everything where we stand from a DPS-CD point of view was articulated in the open letter that I sent. The reality is I, as superintendent, do not see this pandemic calming until May or June at best. And so I'm advocating for the state to announce a closure of schools so we can plan accordingly, continue online learning, not required, but enrichment, so we can focus on preparing for the summer, the fall. In addition, and I know other people are working on this, including myself, we need clarity from the legislature that we will be funded for 180 days and per pupil funding will not decrease. I know the governor is supportive of that. I haven't heard that the legislature is not, but I want to be clear, I haven't heard the legislature is. There are some leaders saying different things, but until they act or they empower the governor to act, we are in a place of hold. And so we're paying all of our salaried employees and all of our hourly employees up until April 13th. And I want to pay them their full salary throughout the rest of the year, even if we don't go back. But the governor or the legislature has to act and give guidance so that we do not have a financial crisis down the road. Meaning if we continue to pay people as if everything is status quo, being paid the current per pupil rate for 180 days, and then the rug is pulled underneath us, and that's not happening, then we will be in a deficit, which is the last thing we want as a school district that is moving in the right direction financially. So I think that covers everything. I got on the call late, but I think Dr. Rice explained his thoughts on graduation and promotion. Our point is that graduation requirement should be everything minus the last semester of credits. So wherever a student was before this last semester, if they were on pace to graduate, then they should graduate. And then we look at everyone else based on where they were before schools closed, and allow school districts through teachers and parents to make decision on who's promoted. And then every subsequent grade from, let's say, 6th grade to 11th, their graduation requirements would be modified to subtract what would be required this last semester. And then we move on from there. I'm hoping we can offer summer school as an enrichment opportunity, maybe as a credit attainment opportunity at the high school level. But that's where we stand now, and I believe I covered everything, but I'll be open to questions now or later based on the format.
Thanks, Dr. Vitti. We do have a few questions for you, and so I'm going to start where you left off about graduation. A parent has asked, what will happen with senior dues?
Right. Thank you for that question. It's one that I've gotten a lot on social media and on email. I've tried to respond to all emails, but they are coming in fast and heavy. My thought right now is that it is unlikely that we would have prom and that we would have graduation ceremonies. My thought is that we would try to have it in the summer or the fall, the following fall. And we would return dues that were collected. Now, how that will happen, we'll have to create a mechanism to allow that to happen. Maybe in the summer, the later part of the spring, if we don't return to school. I'm very doubtful that we would return to school. I think the anxiety is too high among our employees. And this is going to unfortunately get worse before it gets better. Hopefully, we'll hit a high point of confirmed cases and unfortunately deaths, and then we see a decline nationally and in the state. But until we hit a decline, I don't see things going back to normal. And based on what's happened in other countries, I don't see that decline happening until early summer. So we will, though, give back those fees if they were already collected.
Thanks. I know that you just got on the phone, Dr. Vitti, and so I just want to remind you to try to speak a little bit slower because we've got, we're doing live translation. And so I just got a note to remind our panelists of that. Moving on to a couple of questions regarding our undocumented families. What have we done for undocumented families?
As far as this crisis is concerned?
Yeah, as it relates to school. Mm-hmm.
Yeah, so we've been very clear that there should be no conversation, no request for identity, status related to anything that we do in the K-12 system. So we are not working with ICE or any federal, state authorities regarding the status of students or families. And I've made it very clear that any employee that does so would face disciplinary action. As it relates to this crisis, all families are able to go to one of our distribution sites. Those are now functioning on Mondays and Thursdays at 17 locations. We are now providing 3 breakfasts and 3 lunches on Monday in a grocery bag of pre-cooked meals, and then doing the same on Thursday, but 4 breakfasts and 4 lunches that can be picked up on Thursday, extending the weekend. All of our parents are welcome to obtain that food. We don't ask, even if you're a DPS CD student. We're just serving everybody. So obviously, any family that is concerned about status can participate in that process, and obviously obtain any instructional materials that we hand out. But if there are particular issues or concerns, they can be raised now, or you can email them to me privately, and obviously I'll keep it confidential if there's anything that I need to do to advocate for or stop or continue or promote in order to help our parents and families.
Thank you, Dr. Vitti. I've got a couple of questions, and so I'm going to try to summarize a bit. It's related to that you've called for school to be closed for the rest of the year. And so there are some questions about how the district plans on continuing to support English language learners as well as our special ed and our special education population, and what's the plan for IEPs and BIPs, and I am not sure what BIP stands for. So Dr. Vitti, could you speak to that, please?
Sure. So I just want to make it clear, I'm the last one that would, I want to be in school right now. I want our students in schools. I think it, for all the reasons why we offer school. I think our students are supported with caring adults, learning is going on, we're feeding children, we're dealing with social emotional issues. I want that all to be in place, and I'm not simply just giving up. I'm just trying to be realistic. It just feels like other states have already declared that schools won't be back in session this year. There's a lot of planning that needs to take place to shift to more online learning throughout this year, and just getting ready for a regular opening of schools. It feels like we're in a situation where we're going to assess every 2 weeks, every 3 weeks, whether we should have school, and it gets to a point where we can't move on one way or the other in our planning. And that's why I made the call to just simply announce now. But I'm not flippant about that. I'm not being careless. I'm not ignoring what schools provide. I just know the high level anxiety of our employees and how it felt when I was advocating to close schools when we did through the governor's office. And I don't see that anxiety lessening in a couple of weeks. So if it's not going to lessen in a couple of weeks, we're just postponing the inevitable and not allowing us organizationally to shift to better help students and families in the predicament that we're in. With that said, is supporting our English language learners and our students with special needs is difficult when we're not interacting with them one-on-one or in small groups. I know a lot of our teachers have reached out to our families and our students with special needs and English language learners, but we need to do more of that. I think, and this is one of those reasons why I would rather announce the closing of schools so that our teachers can shift to interacting with our students more one-on-one, through FaceTime, through Teams, through Zoom, and other ways if the technology is there in the home. And I know that's a legitimate challenge, but for some we can work through that. Others we won't be able to. But that's one of the reasons why I want to shift, because then teachers can shift their mentality and their focus as well easier if we know this is where we stand in the next couple of weeks. We are going to be offering more learning opportunity, more materials by mid-April, especially if we continue to have a postponement of school. And with that, more clarity on how we can support our English language learners and our special needs students.
Thank you so much, Dr. Vitti. And one last question, and you sort of got to it, but just could you share a little bit more about the special resources that you're trying to put together to address the digital divide in our community during this time?
Yeah, it's been one of the most challenging aspects of all of this. I think David mentioned it, where we've always known that there's a digital divide. We know there's a socioeconomic gap in this country, in the state, and specifically in Detroit. And when you have a crisis like this, those issues become more clear. So, when we started doing this work 2.5 years ago and taking over the district from emergency management, we were almost at for one laptop, it was to every 6 students. Now we're down to about for one laptop for every 3 students. So we've made some significant investment in laptops, but obviously there's much more to do when you look at what a lot of wealthier suburban districts can offer. Right now, our challenge is, one, trying to obtain laptops to give to families. And we've had some conversations with businesses and philanthropy to do that, but we don't have a financial commitment at scale to reach the majority of our 50,000 students. So we've had commitments for a couple hundred here, maybe 1,000 here, but that's not going to solve our problem. And my sense is, if we start giving out 100 laptops here, 1,000 laptops here, we're only going to frustrate the community more, because we're just going to heighten the digital divide and the have-nots. So I'm looking at this crisis as a lesson to everyone, the legislature, the business community, that if this ever happens again, that we are resourced well enough to provide students with family laptops. The other issue, as you know, is it's not just laptops or a device, it's internet access. And that's a multi-million-dollar effort. So we're working with philanthropists now. Instead of giving every family wireless access, maybe creating hotspots in neighborhoods through the city, which would then allow multiple homes and households, apartment complexes to have access to the internet. Those are things we're working on, but I will address one recommendation that I've heard, which is we have about 35,000 laptops, and people have said, well, why don't you give out those laptops? The reality is it would take us 2 months to re-image those laptops in a handout, and then if we handed those out, that means we're not handing them out till June. Then we don't have a solution for wireless access at home. And then when we start the fall school year, we would have no laptops in our schools. So then we would just continue the digital divide challenge with not having laptops in school in the fall, because we wouldn't be able to purchase, order them, and image them in time for the school year to start. So to just repeat at the highest level, we're trying to provide wireless access through the city through hotspots, and we're gonna build more resources online, but at the same time print everything that we're putting online in packets, and then hopefully students and parents can pick up the packets at the distribution sites by the next set of academic packets by the middle of April. I just don't see an at-scale solution between now and the end of the spring, beginning of summer.
Dr. Vitti, thank you so much. There are many more questions for you, as you can imagine, but we've got some other panelists. So for those of you that have asked additional questions, we will make sure that we get those to Dr. Vitti, and he has committed to answering those. We will make sure that they're posted on COVID313.org by Monday. Thank you so much, Dr. Vitti.
And
Jametta?
I'd also say if whether it's the beginning of next week would probably be better if we want to schedule another call, and I'll, just for DPSCD, I'm willing to do that early next week as well.
Yes.
Great. Thank you so much, Dr. Vitti. Jametta? And thank you for your leadership.
Yes, and absolutely. We want to reinforce and thank you for your leadership, Dr. Vitti, as well as the leadership that we're hearing from the state and we'll hear from in just a moment with our charter schools as well. I do want to let you know that many of you have sent in messages saying, how can we partner? Well, I think you're hearing from our educators who are administrators over significant numbers of dollars. They still need resources. So there's a lot for us to advocate for. But speaking of advocacy and leadership, we'd like to transition now to hearing from Dan Creasenberry, who is the president of the Michigan Association of Public School Academies. Dan, would you like to share some information for us, please, about the perspectives and work that the charter schools are engaged in around this virus?
Absolutely, Jametta. Thank you and Christine and all the partners for pulling this together. It's frustrating for everyone to be in such an uncertain time, and it certainly is for parents and people in the community, for students who are trying to continue in some way. So thank you for organizing this and inviting us to be part of it. You're going to hear some consistency from me that you heard from Dr. Rice, David Hecker, Dr. Vitti. I represent all the charter schools in Michigan and certainly work with the authorizers who are mostly higher ed institutions. So we too are committed to being partners in this and doing everything we can. I heard Dr. Rice say we really need to do our best in the circumstances. I think you heard that from David and Dr. Vitti, and you'll hear a consistent message from us. So I wanted to focus on the three things that those of you that organize this said, hey panelists, what are three things your community is doing to help here and highlight those? The charter schools that serve half the students in the city of Detroit were quickly, as everyone, we were scrambling to figure out, okay, how best can we restructure the work that we're all called to do, and that first and foremost was meeting the nutritional needs of our students that we serve in the city. So many have stepped up. We have over 20 charter schools that are sites for distribution of breakfast or lunch, and they're continuing to do that throughout the city. I haven't found the best site for that, but I know Gleaners had a website for it. Crane's article has pointed us to a website, and maybe that's something the partnership could point to, is where all those locations are, but they're throughout the city. And that'll be continuing from everything that we've seen. Again, over 20 sites where nutrition, breakfast, and lunches are continuing. You've heard a lot of discussion, a lot of questions about education and what in the world does that mean when school buildings are closed. Again, I'll be saying the same kinds of things you heard from Dr. Rice and others, is what we're calling the continuity of education. This is a very difficult time. Face-to-face learning is always the best. But there are a lot of schools. We have cyber schools who serve students fully online in the city of Detroit. We have hybrid schools that do some site-based and online learning. So the point is we have some expertise, and everyone's quickly transitioning to figure out how to provide that support at home to students, recognizing fully that it is not ideal. It's not what's going to be normal. It's going to be difficult not only for students who aren't used to that, for parents who may be busy with jobs or staying at home and figuring things out themselves. It may be difficult, certainly for those that have been mentioned with the gap in technology, either internet access or devices. But the contrast is just as bad. Again, Dr. Rice mentioned that. Doing nothing is not acceptable. So continuing education as best we can in these circumstances and progressing from enrichment opportunities to really getting to the place where we're progressing with academic achievement would certainly be the goal. And so you have charter schools across the city who are in different phases of their own experience or capability in doing that. I think it's helpful, at least I thought it would share the strategies that schools have to go through to try to do that in a very short period of time. First, they have to assess where their gaps are as they're building their students, the people they serve. What kind of technology do kids have or don't have? What technology does the school have? What are the strategies they think will be best for their students? Do they have the curriculum and materials ready to do that? Again, you heard Dr. Vitti talking about that as well. Every school building will be somewhat different with that. Then they're going to put those strategies together, whether it's printed packets, whether it's doing things online. And I want to hit something that I know Dr. Rice and Dr. Vitti were both talking about, but there are different ways to engage people. So whether that's face-to-face when they're coming to pick up lunches, or maybe it's accessing social or emotional health, mental health that schools are providing, there are ways, phone, internet, some of those things at a safe social distance where people can still be supported. So we would encourage people to look for those. What is your building doing? What are they capable of? And engage on the other way, because we know from talking to school leaders in the city that as they've been working to do that, they have 50%, 60% of their families engaging effectively. We want to increase that and make sure that people are working as hard as the schools are to try to make that engagement work, understanding that it's very, very, very difficult. So yeah, once they do that, communicating to their families and their community what they are capable of doing. So all of that's to say, wherever your child is attending school, and possibly even DPS-CD, finding out what that building your child goes to is capable of, what's the plan, and working as diligently as our educators are in engaging. There's a reality here I want to highlight, which is we certainly know kids need to learn. They want to learn. We also know our teachers need to teach, and they want to teach. It's therapeutic for all of us to have that purpose going forward. So we're doing our best with the charter school sector in the city to provide that ongoing resource to people. Last piece I want to mention, Jametta, is that as an organization, even on a statewide basis, working with the authorizers, we are collaborating with all the schools across, whether it's a district school, private parochial, charter schools. We're sharing best practices, we're sharing resources. Those that have already had and built some expertise, whether it's digital engagement, maybe it's language, maybe it's figuring out how to best serve students that may be homeless or may be at risk in some other way. There are people that have expertise in all these areas. We're sharing and cross-referencing that expertise with people who may not have it and are going to need it ASAP. So those are important things we're doing. Again, nutrition and the physical needs of our students, all of our kids in the city, continuing education in the circumstances we're in, no matter what that looks like, and then sharing and promoting best practices. But I'd be happy to take some questions. Again, I want to be efficient with the time I know we have.
Thanks, Dan. We have a few questions. One is related to senior dues, and I'm not actually sure that you can answer this, since I'm assuming each school has its own, process for this. But how will students attending charter schools receive refunds for their senior dues? Do you have any?
Yeah,
thoughts
that would
on that?
be different. Yeah, thank you, Christine. That'd be different based on every school that people are attending. So you'd want to check with the schools. And our schools are open and operating even when they're not in the buildings. So we believe every school has been communicating with parents. There should be contact information how to reach out to them individually. Dr. Rice did talk to the graduation requirements. those are things that are evolving. I was in a meeting yesterday where Dr. Rice and others participated, and some higher ed institutions were involved. I think it's helpful for parents, the community, to understand that higher ed is looking at that. They're aware of all this as well. It isn't just our seniors, it may be juniors whose trips to universities or their testing assessments to enter college is going to be disrupted. Higher ed is already looking at that and trying to figure out what are we going to do, because this is just going to disrupt things. We hope shorter than longer, but everybody knows it's lasting impact.
Thank you, Dan. There's a really important question, and so I'm gonna say it out loud. I'm gonna ask you if you will take it back, and we'll make sure that the answer gets posted on Monday. But someone has asked, what is being done to help parents with literacy issues? How are they being equipped to better help their children at this time? And I think this is a really important question, which is why I wanted to say it out loud in the webinar. And we'll also post this to Dr. Beatty as well. So if you could take that back, and Essence, who asked the question, we will make sure that that is up on the COVID313 website on Monday. Go ahead, Jametta. Thank you so much, Dan.
Thank you, Christine, and thank you, Dan. You certainly lifted up something that many of us, like Detroit Parent Network and others that work directly with parents, we know we have parents who are awesome, who care deeply, love their children, but have had experiences or themselves are challenged with literacy. And so it's extremely difficult to navigate the huge amount of information coming at them right now, and the digital divide, let alone if you are challenged around literacy. So we're looking to hear that not only from educators, but there are a number of organizations in the community that have been working on this issue. But when we talk about and think about literacy, it also ties into our perspective and our support for early childhood. And when we talk about early childhood in the city of Detroit and the state of Michigan, we're talking pre-birth to age 8. And we're so delighted to be able to have someone from the Office of Implementation for Hope Starts Here, which is precisely a collaborative effort to bring people together to focus on how we can make sure all of our children are thriving before they are born, in fact, and certainly in preschool and up into their elementary experiences. So to do that, we're really happy to have Jeremiah White from the Office of Implementation. He is the Success Manager. And Jeremiah, thank you so much for joining us. We were not able to have Denise Smith today, who we know is listening in and doing the right thing, keeping herself healthy and her voice intact. So Denise, a shout out to you. And Jeremiah, welcome.
I do not see Jeremiah on the list of panelists. We might want to go to the next person and then bring him back up.
Okay, sure. So he was one of our folks that was identified for us. And Jeremiah, if you join us, be sure just to give Molly or Christine and I a ping, because we certainly want to hear the voice of our early childhood community as well. But as we think about early childhood, we know there's another constituency that is so important in this work. And we're here to talk about resources. And one of the things that we're trying to do with this coalition is to align our information and make sure that we have trusted resources and that parents don't have to go to 72,000 different sites to get information. And so we now have the COVID313.org site. And the person that has been so instrumental and been working tirelessly to make this happen is Monica Rodriguez, who's the Director of Children and Youth for the City of Detroit. And we want to introduce her and let you know we're all giving you a shout out, because we have a wonderful new website that all of us are going to be working on that we know parents and youth can use right now. Monica.
Thank you, Jametta. So first of all, thank you, everyone. I think what's been particularly inspiring about this moment in time is my role is to sort of zoom up and out and ask what's going on with the children in the city of Detroit. What do they need? How are they doing? And that answer, I don't have head on, but what I do believe in is the momentum. And there's a lot of people around right now trying to make sure that children are okay and that there are resources available for them, and most specifically that they are accessible. So my role in all of this is really to not recreate anything that's been done, but to create space and spotlight for those who are around the city, making sure that our children have what they need. That has turned into COVID313.org. It's something I encourage you to go in on your phones. It's meant to be mobile, not necessarily on a desktop, so it looks best on a phone. And what that site is, it's meant to be a hub to avoid sort of the runaround that happens when you're trying to find information at this scale. All of that content is curated from this partnership here, the coalition that's developed in response to all of this as it relates to serving children and youth and families. We do our best to link you to the most reliable and actionable resources. Everything is sort of crowdsourced, and in that way we have named experts in different topics, different buckets, to make sure that folks are looking out for the most important information as it gets online. So COVID313.org, there's a few primary features I'd like to just point out and have you all look. If you first go in, you'll see that you can sign up for text updates. We'll reserve those updates for the most critical information. So we are not here to spam you or just add another news stream. We want to make sure if there's something that a parent or someone connected to a school child in the city of Detroit needs to know, we are able to get that out to you. So beyond the text updates, that food, there's been a lot of conversation about food and a few maps that have circulated. We found quickly a need to be able to understand all of the food locations in real time across all of the networks, including Charter, the sites that the city is offering, DPSCD, and most specifically for a family to act on that and say, for example, it's Tuesday, I know I'm going to need to get food on Wednesday. What food is closest to me? And what am I eligible for? And so if you go to COVID313.org and you click the food link, you can look at that map. You can filter by different things. That food database is meant to be more than just students. Really quickly, when we asked, how are the kids? The answer to that is like, how are their families? When we think about families, right now we are then sort of the backdrop of most of the people we are interfacing with. And so that map will have food for students, but also for seniors, for families, grocery pickup, all of those pieces. So please use that. We are doing our best to keep that updated in real time, but it's meant to be able to combine for everyone when something is happening, so you show up at the right time and where it's happening to make sure food is accessible as possible. So food is a big one to look at. There is a section there for learning resources. There are a lot of things on the internet around sort of how to provide resources for kids right now to get the most out of the time we have to boost their academics. That section has been curated by a team that is looking for the best of and making sure that we have interactive experiences, exposure to new topics. We've hit a large swath of kids, so from toddler, elementary, middle, and high school. That learning resources tab should offer sort of a one-stop shop for parents looking for things to engage their children in. The tools for your schools section is meant to highlight specific communication from schools. So if you look there, for example, you'll see DPSCD. If you click that, you'll see direct access to all of the learning packets that they have put together, the most critical information that they have lifted up. If there is a school that is not on there that would like to be added, at the very top, there is a link that says add a school. Those resources will get added in real time. So continue to share that to make sure if there are parents who are not necessarily connected to their current school's listserv, if they end up at COVID313.org, they'll still be able to find the most relevant information from their school. Outside of that, we would encourage you to just browse all of the options. The point of this is to serve as a resource of all of the amazing and folks out there doing really urgent work. So if you run across a resource that is helpful, that you think should be posted, there's a way to do that. Add a resource, click there, fill that out. We're really looking to identify the folks who have put time and energy into figuring out what are the most essential needs of different pockets of people right now. And so as those continue to develop, as we all sort of evolve in this work together, please make sure we know who those people are and we can bring them into the fold. So on behalf of the City of Detroit, our lens here is to make sure that the kids are okay and that the people in front of them are okay, which is their families and the households that they're around. And anything that can be done to support that, we are actively engaged with. I think that's
Monica?
the slowest I've ever spoken, and I apologize because I think that was still too fast. So hats off, translators, thank you.
Yeah. Monica, thank you so very much. And yes, I did notice that you are a speed demon, articulate when you speak, and you were certainly pacing enough, I think, that all of us were able to understand you very well. And those of us that are listening are excited that we have this new tool in which we can better inform and support our parents and collaborate collectively to make sure that they're getting real-time and trusted information. So again, thank you so very much. We're going to move forward with our expert voices. And what we'd like to do now is to shift to look at basic needs, which we know is so critical because while we're talking health and education and resources, there's the question of water, there's the question of electricity. There are a number of things that families are having to juggle at this critical time. And one of the major institutions that we have a resource for us is the Wayne Metro Community Action Agency for both Detroit and Wayne County. And so we're so delighted, Louis, to have you join us. Louis is the CEO of the Wayne Metro Community Action Agency and has a host of resources and information and a deep commitment and expertise around this area. Louis, thank you so much for joining us.
Well, thanks, Jametta. Thanks for inviting us. And I appreciate all of the work of the COVID313 Coalition. And I hope everyone who is on the call or viewing, I hope all of your families are safe and healthy. Again, I appreciate the invite, Jametta, and Jametta is also a board member of Wayne Metro, and we are just glad to have Jametta and the Detroit Parent Network as a resource to our agency. So first and foremost, Wayne Metro is working virtually to serve Detroiters and serve residents of Wayne County. We are abiding by the governor's directive of stay home, stay safe. So currently all of our facilities are closed, but we are serving people remotely and virtually. And so what I would like to do is just direct all of you to our website, which is www.waynemetro.org, and that's www.waynemetro.org. And I'm going to talk about in a minute just our four main areas of basic needs in terms of that we have funding currently available to serve those in crisis. So let me talk about first our four priorities. Our four priorities, as Jametta stated, one is water. We want to make sure that if you are a resident of Wayne County or a resident in the city of Detroit, that your water is on. We also want to make sure that your utilities are on, meaning your DTE bill. We want to make sure that that's current. If you're having an issue with property taxes, we can address that. And then lastly, I'm going to talk about hygiene products. So again, those are our four priority areas: water, utilities, taxes, and hygiene products. So how can you access those services? What is the easiest way to get a hold of us? Please call our Wayne Metro Connect Center. The phone number at the Wayne Metro Connect Center is 313-388-9799. Again, 313-388-9799. Our hours of operation at the Connect Center are Monday through Friday from 9 a.m. until 7 p.m. And we are taking calls on Saturdays from 9 a.m. to 12 noon. You can also, if you go to our website, on our website, we have people available to chat with you. So if you have a question that you can't find something on the website, go to the chat feature button and a live person will chat with you And you could also email us a question through the website also. So there's multiple ways to get a hold of us. Also on our website, there is a dedicated page for COVID-19 resources. And that page of the website is updated daily. It has links to the City of Detroit information, City of Detroit Health Department, the CDC, the Center for Disease Control, and also there are information that we have linked from the Michigan Department of Health and Human Services. So that page on our Wayne Metro website is a one-stop shop for information related to the virus. And again, it is updated daily. The one thing that I would like to discuss a little bit more in detail is water and water assistance. Wayne Metro is currently administering the Rapp program, the Water Residential Assistance Program for the City of Detroit, and the Water Restart Program. So if your water is currently shut off, or if you received a door knocker that you are in a shut off state, please call us at the Connect line or go to the website for additional information. Funding is available to get you enrolled. We have staff standing by to take your calls. Funding is available. The wait time for a call is about 1.5 minutes. So please, please just stay patient if you do call us. We will get you enrolled in that program and we will get your water restored in a timely manner. Again, funding is available. The eligibility for the Rapp program and the Restart program has dramatically increased due to this crisis to 200% of poverty. So what that means is for a family of 4 making just under $50,000 a year, you can qualify for this program. So if you have any questions or concerns regarding water, I urge you to call us again at 313-388-9799. Also, a couple other pieces of information regarding DTE bills and property taxes. The Wayne County Treasurer's Office has suspended all tax foreclosures for the tax year 2020. Also, DTE has suspended shutoffs through April 30th for seniors and very low income individuals. And if you have any other questions or concerns regarding those two issues, you could always reach out and call us. Also, we do have funding available to assist with property tax foreclosure and utility bills. So even though there is a stay on shutoffs, if you feel you're going to be in a situation where those utilities could be shut off, or you could get a foreclosure notice, also call us. Funds are available. Last, regarding taxes, just so everybody knows that the IRS has extended the filing tax deadline to July 15th, 2020. Wayne Metro does have a free tax prep program if you make under $56,000 a year. When the stay-at-home directive is lifted, and you would like to get your taxes done for free, again, please call us at that Connect Center number and we will get you a tax appointment. Last but not least, I'm really pleased to inform everyone that Wayne Metro will be receiving some stimulus dollars to help with this emergency. I'll have more information on the amount of dollars that Wayne Metro will receive to help City of Detroit residents in about 2 weeks. So I would like to come back to the coalition and give an update on stimulus dollars and how we're using those dollars to help the needs of the community during this crisis. One thing that we are looking at that we think for parents and parents with young children is diapers and wipes and formula and baby food. With some of these stimulus dollars, we are going to make a concentrated effort to provide diapers, wipes, formula, baby food, and hygiene products to those that need it. Working with our other Head Start partners such as Matrix and Starfish Family Services in the city. So more information to follow on that based upon availability and funding. But again, I will know and have more information on that in about 2 weeks. So with that, I would just like to thank everybody for listening. Please use Wayne Metro Community Action Agency as a resource. We are here to serve. If there's something that you need that maybe I didn't mention, just call the Connect Center and we will be able to help answer your question or direct you to another partner agency that has that resource. So again, thank you for your time. Please stay safe. Thanks, Jametta.
Yes, Louis, thank you so much. I'm sure many of you were attentive and hearing these resources that can make a difference for you, your family, and your friends right now. I invite you to take a look at our chat. Someone in that chat is doing a marvelous job because they are capturing literally a lot of the information that our experts are providing. So you're getting some real-time information. And of course, as Monica Rodriguez said, you can also go to the COVID313 website. But as we talk about phenomenal basic needs resources that are here and organizations that have been making such a difference in our community, we'd have to obviously lift up United Way of Southeastern Michigan. And so not only has United Way been coming to the table consistently to support the entire continuum of babies all the way to our seniors, they really are stepping up too in terms of the threat, the critical nature of this virus. So with that, we're so delighted to have Dr. Deon Hudson to join us to share some of the phenomenal resources and the vision for what United Way can provide to us in this crisis. Dr. Hudson.
Thank you, Jametta, and good afternoon, everyone. I really appreciate all of the work that you're doing to pull this together, to pull us together during this time. Before I go through my quick list of resources, I do want to make sure that I'm giving a direct response to the question around adult literacy programs. My team actually sent me a list, and I talk really fast. I'm sorry. Let me bring it together here. But they did give me a list of resources for adult literacy. Keep in mind, a lot of these programs are now closed, but they're still the same way we're all adapting. Everyone is adapting to still offer services virtually. But I'll just give a very quick list. The Southwest Economic Solutions, Dominican Literacy, which is housed at the Samaritan Center, St. Vincent, and the Sarah Fisher Center. And then Reading Works is the umbrella organization that serves the entire city. And so I can easily give that information to you and Christine Jametta to have that posted on the COVID313 website. But I strongly encourage anyone that is having adult literacy challenges or just questions on where you can find resources to please seek those organizations out. And again, we'll make sure that we can even put that on our website as well. So 4 things I wanted to share with all of you today. And keep in mind, my heart is always with teaching. I started out in DPS as a 4th grade teacher at Greenfield Park Elementary School. And everything we do at United Way is focused on making sure all of our children are thriving and that all of our families are stable. So first and foremost, 211, just 3 digits that you have to remember. This is the number you call for information and referral, whether you're looking for housing or shelter, whether you're looking for food distribution sites. It will connect you to over 1,000 different agencies. You can call 211. You can go online to our website, which is unitedwaysem.org/211. And I hear a lot of voices. Can you all hear me?
We can hear you now. Please
Okay.
proceed. Thank you.
Okay, no problem. You can go to our website. I'll say it again. It's unitedwaysem.org/211. And you can just type in simple words like diapers or water or rent, and it will refer you to agencies that are within your zip code. You can also go to COVID313.org that Monica was referring to, whether it's the website or the app. And there's actually a tab that you can click for 211 that will take you to those resources. The second thing that we're really focused on is information sharing and resources through social media. If you type in United Way SEM on Facebook on Twitter, on LinkedIn. You will see postings from not only United Way, but all of the agencies that we partner with, and being able to get the word out about where you can find resources. We also have a webpage that's been set up called it's unitedwaysem.org/COVID. This is also linked to COVID313.org. So everything you're hearing today is connected. You'll be able to go here to get a number of different educational resources, learning materials, access to programs like ABC Mouse, Ready for K, and other virtual learning capabilities and programs that we have available for our families. Third, I wanted to share our community response. We have actually launched a COVID-19 Community Response Fund. It's in partnership with 15 different organizations and several individuals in our community who have answered the call to help raise funds for so many agencies and individuals who are in need. We've raised $6.5 million. We are trying to raise $10 million for the community. And a very special thank you to those who are given. We've actually had over $60,000 now in donations just from individuals. So all of these dollars are going right back out the door. We funded 60 agencies so far. I want to give a special notice for all of the school districts. I know there are several that are listening. We are also taking applications from school districts, from the ISDs. We have received so many questions around the digital divide, getting the technology needs. So we are having constant conversations, working with some of our businesses who have offered pro bono services to help with the reimaging of laptops. And we're also working across multiple agencies to make sure we're getting that technology in the hands of our families. Lastly, I just wanted to mention our volunteer efforts that we're also helping across the system with. There's dire need right now for blood donations. Please call your American Red Cross. They had a need for blood donations before the pandemic. I'm sure you could appreciate now that that's exacerbated. So we want to make sure that we're still helping them. We have a number of different agencies on the front lines who are focused on food distribution and delivery, as well as Wayne County, and working with the Lisa Whitmore Davis, with the Office of Senior Services, and getting those resources to our families. And so if you have the time and the will, you can go to our website. Again, it's unitedwaysem.org/COVID. And you can just click there and you'll see hundreds of different opportunities for volunteerism. We also have volunteer opportunities that are virtual. Someone asked the question earlier about how do we expand this partnership? How do we come together? This is how. There's so much that we can do, whether we're tutoring third graders who are trying to learn how to read, and then we can also connect with our seniors, our older adults who are isolated through a program. It's called Points of Light. And so you can also volunteer in that way. And lastly, what I'll just say is these calls, these coming togethers are so important and so critical. We want to make sure we keep each other lifted and informed at this time. There is no question that you can't ask. Please lean on this coalition to ask your questions. We will work very hard with Christine and Jametta and Monica to make sure that all of our resources, everything that we have is posted, is available for families and children who need it. Thank you.
Thank you. Thank you so much, Dr. Driver Hudson. You've identified a huge number of resources that we need right away. So at this point, before we close, I understand that we have another speaker. And so I would like to be able to hand that to Christine or Molly to introduce our next speaker. And then at some point we will begin to wrap up. Please make sure while we're preparing for the next speaker that we have your questions in our chat. We also invite you to put your email in there if you would like to be continually part of this information as we go forward.
So we'd like. Is Christine here? Christine?
Yep, I'm here. I'm sorry. Are we closing now?
Now we have one more speaker. We have Deon Williams from the Office of Gretchen Whitmer, the Director of Faith-Based Affairs.
Great. Welcome, Deon.
Thank you all for having me on. This was a well-rounded conversation today, and I just want to let everyone know that we greatly appreciate your support, your prayers. We ask everyone to stay safe out there. Take care of yourself. You have to do self-care first and foremost before you're able to take care of anyone else. So we appreciate all of the resources, all of the partnerships. I believe that Dr. Vitti, Superintendent Rice, Dr. Hecker, and everyone, they spoke on the educational piece, understanding that the governor is definitely, first and foremost, exploring everything that's at the table. We are trying to mitigate any issues or any misconceptions of what's going on when it comes to educating our youth, understanding this is a public health crisis, and the health and safety and the well-being of our students and educators is our top priority across the state, as well as all Michiganders. We understand that in this time and in this effort, one classic case of each one of these districts, one size doesn't fit all. So we have to take a flexible approach to making sure that our students are educated and that our community get the resources that it needs. Many of you might have seen that the governor at 11 o'clock today did a press conference, and she did a national request for a major declaration, a disaster declaration from the federal government. If it's granted, in full, among other things, a major disaster declaration, would help provide the state with meals to families who need them and provide rental assistance, temporary houses to families. It would also provide counseling and therapy for Michiganders and residents with mental health who are affected by COVID-19, whether it's your loved one, whether you're sick or in the hospital. These are resources that we're going to need moving forward as we come out of this crisis eventually. Understanding that also the program the governor requested to assist Michiganders during this time will include, but is not limited to, categories of individual assistance, disaster unemployment assistance, disaster crisis counseling, disaster case management, individual and housing program, disaster supplemental nutrition assistance program, disaster survivor assistance, legal services, volunteer agency coordination, and it also will help with FEMA bringing in more money to our community for the things that we need. So again, with that, and I know everyone has put out their information on the website, a list of web pages that you can go to for more information. You can go to michigan.gov/coronavirus, or you can go to cdc.coronavirus.gov, and you will be able to get more information as far as the resources that we have from the state, as we're partnering with our philanthropic community, as we're partnering with DPS and all of our other agencies that are out there. We're in need right now. We are facing a crisis. Our number that you can call for our hotline is 888-535-6136. Again, that's 888-535-6136. And understand this, and I know we haven't mentioned it, but in 2000, our state was properly counted. We received the resources that we need from our federal government between 2000 and 2010. In 2010, the state of Michigan was going through a crisis during that time of unemployment, the housing collapse, and we weren't necessarily properly counted. Right now, 2020, this is the time for the census, making sure that we get properly counted and we have the resources that we need for healthcare, education, infrastructure, things of that nature. While we're at home and we're in our homes right now, you can go online. Census 2020 is live right now. Please, we employ everyone to go out, get counted, or not necessarily go out, don't leave outside your homes, but be at home, get on your computer, fill out your census so that we can properly get counted, so that we can get the resources that are so much needed inside of our community. And with that, I appreciate everyone for being on this call. And if there are any questions or any comments, I'm more than willing to take them.
Deon, thank you so much. And thank also the governor for her leadership and her transparency and an intelligent and competent response to this virus, as well as her whole administration. And we see this when we talk about our partnerships, the strength and competency of everyone in this coalition. Again, across a number of people, we invite you to look at the partners. And yes, those of you who are interested, we're seeing text messages coming in saying you want to be part of the coalition, because we're here and we'll be coming together every week on the same time on Thursdays. But you also have another opportunity, and that's to be part of the Hope Starts Here imperative number 2, which is a focus on parents and families tomorrow. So if you go to the hopestartshere.org website, also we have in our 313 COVID313 information about Hope Starts Here. Tomorrow from 10 to 2 is an in-depth opportunity to hear more about childcare, to hear more about the resources and information and support that pregnant families and families with young children and in early elementary are available to you, as well as to become part of this opportunity for us to all work together for our children. So I want to thank you. It's been a blessing to be part of this important work, and I'm going to hand it back to my colleague, Christine.
Thanks, Jametta. Thank you for everybody who stayed with us past 2 o'clock. We really appreciate it. And as you can tell, there's a lot of information to give, and there are a lot of questions that we all still have. That's why we'll be here every Thursday from 12 to 2 to bring you the most up-to-date information. Please sign up for the regular updates on covid313.org or put your email or phone in the chat on Zoom or on Facebook. These are really unsettling times, but we know that if we work together, we can find strength in each other. As a community, we're here for you and for each other. Thank you so much, and we'll see you next Thursday.
And Christine, the good news is that for those of you that are wondering, well, how do I get more of this information? We want you to come next Thursday. Thank you so much. But we also want you to know that Detroit Public Television, DPTV, is working with us to make sure this information is available to you going forward. You can go to dptv.org and have free streaming later today if you've missed any of the tremendous information and resource information and experts that are here. Again, go to dptv.org to catch the streaming, and we'll look forward to seeing you next Thursday, and make sure that we stay safe, healthy, and believe in our opportunity and possibility to overcome this. Thank you.